Hello. Good morning, everyone. We hope you're all doing great. We are back here for another Sama Saturday, 10 a.m. Pacific time. Every Saturday morning, we're coming together here on the Sama Dog Wellbeing Facebook page to share with you the knowledge of holistic and natural wellness for you and your furry friends. We really get into the body, mind, and spirit of every aspect that we're talking about so that we see ourselves as these holistic beings, because that's what this integrative approach is all about. My name is Amanda Ree, and I'm the founder of Sama Dog, and I am here with Dr. Katie Kangas, one of my dear friends, our regular on the show, and a super knowledgeable holistic or integrative veterinarian here in San Diego. So welcome back, Dr. Kangas.
Thank you. And as always, thank you so much for having me join you, Amanda. It's such a pleasure to join collaboration and into such a wonderful mission that you put forth. And I'm just thrilled to be a part of it and to share any knowledge that I can that can help more animal people and more human people to be healthier and happier and just live better lives. So thanks for having me.
Of course, love. And she, when she says those words, everyone, like, she couldn't mean it more. Like, this is one of the most authentic people I've ever met. I almost get misty just telling you about that right now, because she really, like, the service and love that comes from her heart and the care that I know when I even see her personally and offline is so authentic and pure that it's just a beautiful opportunity for Sama Dog to be able to have someone like this to bring her knowledge forward. So without further ado, we'll get into it. Do let us know that you're here as you're jumping on. Hi, Jane. Oh, she's coming in from sunny Honolulu. Oh, Jane, thank you so much for following us. I hear sometimes that you're here on with us and thinking about you out in the beautiful Hawaii. Maybe one day we'll be out there, can do our live show from there. Yes. With that intention. So today is all about Q&A with Dr. Kangas. We oftentimes will have a topic of our conversations, but this time we just wanted to really open it up, give everybody a chance to ask the specific questions that might pertain to you and your pups. Now, that said, as you're asking your questions, we do want to make them universal enough so that many of us can learn from them. So whether we have a dog that, my first question will be about kidney disease. So whether we have a dog with kidney disease or maybe cardiovascular issues or allergies, those are all great and universal. When we start to get down into those details, asking over, throughout the series, all these details within the question, sometimes that gets a little difficult for all of us to listen to and relate to. So I just ask that everybody keeps their questioning a little universal so that we can all benefit from it. So please let us know that you're here as you're jumping on, and also if you're willing, share this out there with the world, with your other pet loving friends, because that's what it's all about. It's getting the wisdom to them, right to their doors, right into their living rooms like we're doing now. So what I am pulling up are my questions. And Dr. Kangas, you ready?
Yes, thank you.
Okay.
Can you hear me okay?
Yep, can hear you great. And you guys can go ahead and type your questions below. We'll get to them as we go through this, but we had a couple that were written in beforehand, and we'll get to those first to kind of kick us off. So put your questions below, anything and everything, don't hesitate. So our first question is about kidney problems and how this human companion can transition her pup off of the prescription dog food that they were given via the vet. They want to bring the animal into more natural foods, more healthy foods, fresh, but don't know how to do that. What's best for kidney issues?
Okay. So I'm glad to speak to this question because this is kind of largely either misunderstood or at least overplayed in veterinary medicine, at least from the holistic nutrition standpoint, that so many pet parents are advised to obviously use prescription diets for many different disease syndromes in animals, but kidney disease is really one of the top things that gets a lot of attention with diet prescription changes. And the biggest factor that is usually considered in these prescription diets is low protein, and that's really been established really on some not so good studies way back in the 90s. And it's really just taken off and perpetuated in most veterinary teachings in schools and veterinary presumed knowledge is that protein can be harmful for the kidneys. Now, that's really controversial and disputable, but what we do know, at least thus far, is that it's the phosphorus content that is more of a problem for the kidneys. And the issue is that low quality protein is high in phosphorus. And low quality protein, which is kind of traditionally in a lot of, processed pet foods, does not digest so well in the body. And so it takes an extra toll on the kidneys without really providing a lot of good body dietary, nutrition or nutrients. And so the quality protein or fresher foods is going to be far better for the kidneys than a typical processed diet. Okay. And when I say indigestible protein, see, the thing is, on paper, protein, when they analyze protein on paper, that could be something that, registers as amino acids or proteins, but the body doesn't digest it and really be able to use those nutrients and amino acids and put them into the muscle tissues and elsewhere in the body. And things that might make up that sort of thing would be things like even feathers and, skin and stuff like that, where it may not bring as much nutrition, but still has protein in it for meeting a AFCO or a dietary requirement in a processed food. Okay. So the thing is, now, if you're feeding a very digestible protein, which if you're feeding fresh, meats and organ meats and eggs and fish and things like that, these are very digestible for the body. And so they are not going to do the kind of, cause as much work for the kidneys and still giving the body a really good benefit. So I do agree with transitioning off of the prescription diets. And, as I've mentioned before on previous broadcasts together, I will generally disagree with my conventional colleagues on diet, of course. And I really am not a fan of the prescription diets. And most of you probably know, if you read the ingredient panel on the bag, a lot of them are grain-based proteins, and they use a lot of corn and soy, and there's gluten and other things like that in there to provide protein. And that's just not evolutionarily natural and not good for, long-term use, certainly in the body. So regardless of, kidney disease, and then we can get a little bit more detailed in, if the kidney disease is more advanced, we might want to drop the protein a little bit. But a lot of times, conventional veterinarians, the kidney values in the blood work might be up just a tiny bit or marginal, and they're already recommending a low protein diet, which I would definitely disagree. So I would support you in transitioning over to a fresher diet, of course. And transition should always be done, or at least I always advise that they're done slowly. There are certainly pets that can handle a quick switch, but that's not always going to be the case. And so I think it's always wiser to go slowly and eliminate any problems with adjusting. And so generally with transitioning, whatever you're choosing for the new diet, I would recommend to do about 25% or a quarter of the diet being the new diet, and generally about a week of that. So 3/4 of the old diet, a quarter of the new diet, and then 50-50 for the next week, and then 3/4 of the new, and then maybe the fourth week you're getting into the full diet or the full new, change diet. So that's kind of a good rough, guideline to use depending on your pet, and use your judgment. And then, a lot of discussion on what that diet could be, but there are fresher diets and even raw food diets that are formulated specifically for kidney support. So I know if you're doing a raw diet, by the way, the Darwin's company, which I believe Dr. Karen Becker, maybe Dr. Barbara Royal as well, I can't remember, helped to formulate those diets. And they actually have a kidney supportive diet that's raw, full on raw. And of course, most veterinarians would think that that's, not a good idea to feed raw to anybody with kidney problems. But I've seen patients, even with, all kinds of health conditions, including kidney disease, do great on raw food. So it doesn't preclude raw food. There's also companies that cook food or lightly cook food. And people may be aware of Just Food for Dogs is now in San Diego as well, and in other places in Southern California. And they do like a moderate restricted phosphorus or protein, and then a more heavily restricted, and if it's more advanced disease. So those kinds of things are available. And even My Perfect Pet, which is San Diego based, is a company that does lightly cooked. And they're available in a lot of the smaller specialty type pet stores. And they've got a lot of formulas that can be specifically applied to different health conditions, and even like a low glycemic blend, which I like, and things like that. So there are a lot of options out there. And if you want a little bit more detail on what to feed your doggy, I would love to have you either come in if you're local or call for a phone consult, and we can get a little bit more into detail about specific diets that would be good, and a lot of specific supplements that are so good for supporting kidney function.
Mm-hmm. Well, that's so great. And I think it's such an important point to make, having had a dog with kidney issues and done all the research that you just talked about and seen from every conventional method of like avoiding protein, get it out of the diet. And what you're sharing is quite the contrary, but it needs to be healthy, easily digestible proteins, and that is misinformation that's out there. And that's a strong message that comes through from a lot of conventional vets. I talked to tons of people that have this, so I'm so glad it came up as one of our first questions.
Me too, thank you. And I'll just add one more thing, that a lot of times when there is a kidney disease present, typically it's an older animal. Not always, sometimes younger animals can get kidney issues as well, but oftentimes these are our older, aged, or geriatric pets. And they already, as we age and as they age, the digestion efficiency, starts to decline a bit. And so when you deplete protein in an older pet's diet, oftentimes they're already heading into muscle atrophy. They're already heading into stages of where they're a little bit more weak. Also, when you decline the protein or decrease the protein, it becomes less tasty and less palatable. And we have to remember that these animals, dogs, and especially cats, were designed to eat mainly protein. So it really doesn't make sense to all of a sudden withhold their protein, especially in the elder years where they really need that to put into their tissues to, keep up their energy and their function. So that's a good thing to keep in mind. I'm not a big fan, by the way, as a quick tangent, I'm not a big fan of senior diets. Okay. So those are, marketed a lot, but a lot of the senior diets just have a lot more fillers, a lot more fiber and carbohydrates, which I'm not a big fan of for most, pets in high amounts at least. And so I prefer to stay with a good quality diet rather than really switching to a senior diet.
Mm-hmm. Well, it's so important to recognize that, fresh food is best for all beings of all ages, of all stages. And then using those specific foods that might benefit that circumstance most, but fresh is best. And that's the bottom line.
Amen.
Well, hello, everyone that's been joining us. I just want to recognize all of you. Jessica, oh my gosh, how's your little girl, Jessica? I can't remember your dog's name. Bridget. It's Bridget. How is she? I would love to hear about her. And Lindy, hello, Caitlin, or maybe Janet's using Caitlin's account here. And then Donna, hello, Donna. Great to have you with us. So we love our community. We love all of you, and we love helping your pets. So please let us know what your questions are. This is your chance. People pay obviously hundreds of dollars, if not more, to have their questions answered by this brilliant woman. So that's, again, why we brought her forward. This is Dr. Katie Kangas, for anybody who's just joining, holistic vet based here in San Diego. And as she mentioned, anybody can get access to her, Dr. Kangas, through a phone consultation. So even if you're listening from the other side of the planet, you can certainly have your time to understand your pet more specifically. So let us know your questions. Anything is open for discussion. Just post it in below. And of course, we would love for any of you, if you're willing to share this out there, get this knowledge spread even further and wider. Farther and wider. I've been working on further and farther, learning them for myself. It's a constant growth, right? Okay, so another question, Dr. Kangas, that came in is, what are the key nutrients that need to be added to home-cooked meals? Specifically, she's making lightly cooked veggies and raw or lightly cooked meats.
Okay, great. So
the whole conversation in itself.
It is. It's a big conversation. And, I could start out a little broadly by saying 10, 12 years ago now, when I started doing holistic veterinary medicine, I did counsel a lot on home cooked diets or home prepared diets. And really in the last decade or so, I've kind of moved away from encouraging people so much to do a full-on home cooked diet. I definitely love to garnish the diet with a lot of wonderful medicinal foods, which of course Amanda and I have touched on many times. in our past, broadcasts. So I love adding very medicinal, beneficial foods to, their dish on a daily or regular basis. But as far as doing the whole home cooking protocol yourself, I have found, working with many awesome pet parents over the years, that despite the amount of time and effort that people put into a home prepared diet, oftentimes, the majority of the time, it's still unbalanced and deficient. And so, not that it can't be done right, it can, but you have to do a lot of homework and you have to do a lot more effort than most people realize is involved. And so, certainly there's supplements and that are very important, calcium and minerals and other vitamins that are very important to add, but even just variety in the diet is so important. One of the things that I realize a lot is that when people home prepare a diet, as you mentioned, some fresh meats, oftentimes organ meats are left out. And organ meats are very, very important. And actually, I could even just quickly build on the last question too, when we were talking about kidney disease. With holistic nutrition and even Chinese medicine food therapy, if you have an ailing organ, you want to eat more of that organ. Okay. So if you do have a kidney condition, actually eating more kidney will be very beneficial. So some of the nutritional products I have actually contain kidney glandular organ in them. Okay. But even just a standard pet diet with, no health condition going on for the pet, they absolutely should have organ meat included. And that's oftentimes left out. Also, a lot of times people will use very low fat meats, which, you don't want to add maybe a ton of fat, but a bit of fat in the diet, or, now we're learning more and more fat in the diet is really an important thing. So we don't want to just stick with lean meats. We don't want to stick with always the same thing. A lot of people stick with just poultry and they don't mix it up into some of the, red meats and fish and stuff like that, and definitely organ meats. So those things are all really important. Obviously some veggie content, but at least half of the diet should be protein, and probably oftentimes more. Okay. I'm not big on including a lot of carbohydrates. When I used to counsel people, 10 years ago or so, we used to recommend more root vegetables, and we're kind of moving away. A lot of holistic vets are moving away from that. We still really feel like that's too many. Putting a lot of those in the diet is still giving a lot of carbohydrates that, eventually break down or ultimately break down into sugars in the body and can fuel more inflammation and allergies and skin problems and, even cancer. So I am now moving more towards diets that have a little less carbohydrate matter, definitely including some organ meat. If it's a raw diet, you want to include some bone for the calcium. If it's a cooked diet, you're going to need to add calcium either via a quality calcium powder. I would also definitely recommend a trace mineral powder like a kelp. There's other vitamins and things too, of course, that would need to be added, but variety is key. And the other reason why I'm not so much encouraging people to do a full-on home cooked diet is also because there's a lot of stuff available on the market today that didn't even exist 5 years ago, let alone 10 years ago. So we are very lucky as, educated, growing awareness pet parents that we now have a lot more things available to us that are professionally done well, that are high quality and already completely balanced. And then you can always add to that and garnish it. So, home cooking is still definitely an option, but I just want to encourage people that if you're going to do that, to really do some good homework in balancing it appropriately, including a lot of variety and including some of the nutrients that have tend to be left out. There are definitely some resources for people if you really like doing a full-on home prepared diet for your pet. There are some resources, and there's some veterinarians out there that do that help you formulate the diet completely and balanced. So that is such a involved level of work that I actually don't really delve into that too much. I give people guidelines, but if they really want to do a specific, balanced diet, then I can refer to some other resources that can help people do that. And there's a lot of online and phone consultation things that can be done to easily help. So those are good resources we can post.
Yes, and we will, underneath this, afterwards, we'll post some additional support for all of you. We always do that. I wanted to read this question because I'm curious your thoughts too. Is what's your thought on the Northwest Natural frozen raw patty fish and sardine for a dog with pancreatitis? Just that brand in general. Do you have any thoughts on it? And then the specific pancreatitis.
Yeah. So Northwest Naturals, I think, is one of the, good brands out there. It's on the list of recommended options that I give to people, which includes a lot of other companies too. Northwest Naturals is on there, and I have things like Small Batch and Halston's and Darwin's and Answers and things like that. But as far as that particular blend, I mean, really a fish, I don't know exactly which fish they included, but I definitely am supportive of having some fish in the diet as long as, that's a good match for, there's individual dogs that may not do well on a specific food or, have reactivities to specific foods. But in general, obviously, I do like to include fish in the diet. There's a lot of unique nutrients that fish bring compared to other proteins and meats. So that's great. As far as pancreatitis is concerned, pancreatitis is unfortunately relatively common in dogs. And when the pancreas becomes inflamed, the concern is that the body has more difficulty digesting fats. And so, a lot of advice or prescriptions or recommendations from other veterinarians would be to keep that pet on a low-fat diet for the rest of their lives. I have a little bit of, trouble with that, and I don't recommend that. Now, if this is a pet and I always have other solutions that conventional medicine doesn't have to help get the pancreas back on track and to help decrease inflammation and really support the pancreas back to normal function or better function. And a lot of times in conventional medicine, we're not aware of those kinds of options. And so we tend to go to extremes with either, certain recommendations or medications or whatever. And so typically if a dog has had pancreatitis, sometimes it's only even had it once, veterinarians will say, oh, low fat diet for the rest of this pet's life. As I mentioned earlier in our brief talk about the home cooked diets, fat is such an important thing to include. And if I didn't allude to that clearly, I just add that back in, that diets that are extremely low fat. Now, we all bought into this low fat craze of the 80s and the 90s, most of us humans who started believing that fat in equals fat on. And that has been so disproven. And so many people that home prepare for their pets have very, very low content of fat in the diet. And that is a disservice to their health too. When it comes to the pancreas, I would be cautious, but I would not buy into this pet cannot have adequate fat for the rest of its life. And by the way, fat is needed to process to help the fat soluble vitamins like vitamin A and D and K. It's also very important for hormone and endocrine systems, and it's important for a lot of things in the body. It's a very good source of energy. So want to just kind of preface that into the pancreatitis topic. And then to say that if they do have pancreatitis, one of the things that will really help them digest their food better and handle fat better is to put them on digestive enzymes, okay? Because a lot of the enzymes that help with digestion and specifically with fat digestion are manufactured by the pancreas. So if you're adding digestive enzymes to the food, and there's many different brands and products out there that have these, a lot of them are porcine derived or pig derived from pancreas. Some of them are plant digestive enzymes. I know Animal Essentials is a big, I love that company, and they have a lot of stuff out in the pet store. So a lot of people use their plant-based digestive enzyme probiotic blend. But digestive enzymes are a fabulous thing, oftentimes really for anybody, but definitely if you have a history of a weak pancreas or a pancreas issue, because it's going to take the toll off the pancreas to do as much work, and the food will digest better, and you're less likely to get inflammation in the pancreas again. There are some dogs that get a bout of pancreatitis and never get it again. There are some dogs that get a bout of pancreatitis and will get recurrences down the line. And those are the ones, if they've had repeated episodes of it, I would be much more cautious and counsel those people through, but I would still be optimistic, especially with my tools, that we can nourish that pancreas back to better health to where they can eat a more variety of foods again. But bottom line, to answer the question, I think I would be, from what little I know about that fish particular formula, I would be okay feeding that to a pancreatitis, just depending on if they're healthy right now, what status they're in, and, not a whole lot, as far as volume and introducing things slowly and stuff like that. So use your judgment with all that. But as just a general blanket, statement, I wouldn't have a problem with using that for a dog with a history of pancreatitis.
Okay. Well, that's great. And this information is just, again, so helpful and necessary in the world. I'm just so grateful, Dr. Kangas, for learning from you and through you being able to share it with the world. So did you guys agree? Do you love this conversation and learning this different perspective? Because it's not all the time that we're hearing this, and we don't have a ton of resources for it. So if you agree, give us a thumbs up, because you got both of mine. It's great, such good stuff. So, okay, so just moving on to a different topic now. This is Jessica, my friend from Hawaii, and she says, Bridget has been having some sneezing attacks the last few days and never struggled with, seasonal allergies. So what could be up with Bridget?
Okay, she's in Hawaii.
Yep.
Okay, so I'm not exactly sure, having not.
Well, actually, sorry to interrupt, but actually Bridget lives in Los Angeles and Jessica goes back and forth. So Bridget's in LA.
Okay, so that will alter my answer a little bit, because there are obviously different things in different geographical environments that can make a difference. And, clearly allergies can be a result in any environment for both, humans and dogs. And there may be something at this time of year that has, increased in the environment, whether that's, pollens or, certain plants or molds in the environment or whatnot, that could bring on, these sneezing attacks. So it might be something that is environmental and possibly very seasonal. And hopefully, if that's the case for this doggy, it won't last very long. And hopefully that's a short exposure time in the environment. And there's certainly natural things that we can do to mitigate allergies if it does appear that it is allergies. However, in Southern California, one of the big culprits of sneezing fits is a plant called a foxtail. Okay. And there are regions in the country that do not have foxtails. I'm from Wisconsin and I went to veterinary school in Wisconsin. I've been in California for 22 years, but I was trained in the Midwest and we didn't have foxtails. And literally, I think I remember it like this 2-second snip in a lecture one day going, oh, and if you're ever practicing in California, you're going to encounter these foxtails and they're horrid and they cause all these problems. So, just a heads up on that. But we didn't really learn anything because we weren't exposed to them. So foxtails are very prevalent in the Los Angeles area, I'm sure, as they are in San Diego. And they are little pieces of plant that it almost looks like a shaft of wheat. And when they first grow, they're green, but as they dry, they turn, like a wheat color. And the little pieces of the plant start to, come apart and blow off. And there's barbed ends on them. And they look like this little feathered shaft thing. And they are nasty little plants when it comes to our pets. And they will get in toes, they will get in ears, they will go up noses, and even migrate. I mean, worst case scenario, I don't want to freak anybody out, but I mean, they literally have migrated across the chest wall, across, the rib area and through the muscles and gotten into dogs' lungs. I mean, they've, caused it's crazy that these little plants can really travel up a tract, into the body. And some dogs have to be, put under anesthesia to get them out of their nose or get them out of their feet or their toes or their ears a lot. And so if your doggy ever just acutely out of nowhere starts sneezing and the fits are very, aggressive fits, and especially if there's any blood coming out and if it's seems like it's only one-sided, because if they did get a foxtail up their nose, it would be much more likely that it was just in one nostril, not both. So if there's discharge coming out of both nostrils, not likely to be a foxtail. If it's one nostril and if it's bloody and the fit started very aggressively and quickly, then I would recommend to actually go into a veterinarian and have them evaluate, and they'll probably have to sedate and scope up the nose and pull, and they may find something and pull out. So just keep that in mind. It actually could be what we call a foreign body in the nose, which would typically be a plant material or a foxtail in our region, or it could be allergies. And there's also something called reverse sneezing, which doesn't sound like what Bridget described or Jessica described, but that can look really weird, and it comes on as a quick fit, and they're actually breathing in quickly more than sneezing out. And it's called a reverse sneeze, and nobody really knows what causes those. There's some dogs that do it frequently and some dogs that never do it. It can be brought on sometimes with excitement or just sniffing around and something gets up their nose and irritates it, and they do this little fit reverse sneeze thing. But it can look really creepy, but it doesn't last long, and it's generally not, doesn't result in any problems. So hopefully I covered enough bases.
Yeah, that definitely covers it. And so it's great to know about foxtails. I mean, I've known and seen with my own pups, of course, many different times, whether it's in their foot or wherever it might be, but to understand them better and the degree of the difficulty that can come with them is interesting.
It is. And, even to the point where when my yellow lab and I, Sage, if we're walking, and especially earlier this year when we had so much rain, there was a lot of foxtails out. And as soon as Sage would try and sniff or even squat to pee in any of those places, I'm like, nope, foxtails, we're moving on.
Yeah.
Even when female dogs squat, I mean, sometimes they'll get it in their vulva and it'll stick. I mean, these little plants are little fuckers. Yeah. So they have cost a lot of pet owners a lot of money.
Wow.
To, get these removed out of, different areas of doggies' bodies. And so if your doggy is really hairy with long hair, they're harder to see. So if you do see any of these plants in your area, either, and if they're in your yard, try and, mow them down before they ever grow up to get to that point. But if they're in your area, try to avoid them. And if you have a hairy dog, I would recommend checking them on a regular, just like you're checking for ticks, check for foxtails.
Yeah. Every time you come back in from a walk or whatnot.
Yeah.
And when we find them, just like a tick has a very specific removal method, what is the best removal method of a foxtail?
Well, if it's still sticking in the hair, you can just, pull it out. And it might take a little effort because it kind of sticks in there because the barbs, if anyone's ever gone fishing and, a fish hook has barbs that like go in one direction and you can't tug it as easily in the other direction. So, when it gets in there, sometimes it's hard, but if it's just in the hair, you should be able to just remove it. If a veterinarian's removing it, sometimes sometimes there's an actual wound hole there, opening that we can just stick an instrument in, but sometimes we have to create a bigger laceration or a bigger incision, I should say, a bigger incision to actually go exploring for it. But we would usually take a hemostats up there and actually, pull it out that way or out of an ear with a longer tool like that. But if it's just in the hair, you should be able to pull it out easily, and it doesn't require a special tool like a tick tool or anything.
One little tool that I have around the house that's actually for fleas is super handy for all kinds of fur removing debris. And because sometimes it's quite hard to get out of there, and it's all, depending on the fur of the dog, it's all buried. So I have this little, which of course is very easily available, flea comb, the metal one. On one side has the very tight little teeth that are for the fleas. The other side has a little wider, and I use that little comb constantly, even getting crusted little eye goops out of their eyes rather than digging away. You can just get under it and pull it right off. So just a tip for the.
That is great advice. I love it. Yep. I use flea combs routinely, in my practice to, comb through my patients to see if fleas may be involved with, whatever skin issues they're presenting with and things like that. But I forget that a lot of them have the wider one, which is also very useful. So that's a great idea, Amanda. Thanks for sharing. I think that's wonderful.
Sure. So let us know if you have any questions, anyone. For those that are jumping on, we've got lots of viewers today. It's great because everybody loves the Q&A. It's like an opportunity to learn a lot of different topics, and it's so engaging. So let us know if you have any questions. We'll get to as many as we can. So we did have this one come in from Luana. This was before sentence, so thank you, Luana, for doing that. She just wrote, she's from Minnesota. I have a fearful reactive dog. I forgot that this format allows us to turn it up here. I have a fearful reactive dog. We've seen a vet behaviorist and she put my dog on clonidine. Are there any more natural or herbal supplements, flower essences, oils that you think I could try to use with this? What do you think, Dr. Katie? And I'll just take it down so we can see.
Yeah, absolutely. And clonidine is a newer medication that's being used, as well as trazodone's a newer one. I don't have any personal experience with patients on clonidine yet. I've definitely had patients on trazodone. All of those behavioral drugs certainly can have side effects and issues that come with them, but I'm sure you've probably worked through a lot of, things already. I mean, a lot of times by the time people resort to a behavioral modification, drug, you've probably worked with trainers and other things. And it sounds like you've been working with a behavioral specialist veterinarian, which is great. But to answer your question directly, yes, there's absolutely natural things that can be added to your use of clonidine. And then ideally, and hopefully, and I think everyone's goal with those behavior modification drugs is to use them only temporarily until we find some, better long-term solutions for the pet. And so that's always our goal. But so there are things that could be used in tandem with the medication. And then hopefully, in my optimism, those things could eventually take the place of, or maybe even not, maybe even quickly, hopefully take the place of a drug and perhaps even do better. So, and I'm not sure if you have tried CBD yet, but if you've watched Amanda and I in the recent past, we've certainly talked a lot about cannabidiols or CBD, cannabis derived supplements, and these are powerful plant medicine options. And that was one of the first things that I would use. And if you have used CBD and it did not seem to work well for your pet, I would highly encourage you to contact a very experienced resource for that, because when Amanda and I met Robin Lynn, she's a certified cannabis herbalist, and she is in our area here in San Diego. But again, she does online, Skype consults, she does phone consults. And I just want to let you know that with her expert guidance, the results that I have seen in the last 9 months since I've been referring people to her, the results that I have seen with my patients on CBD products, cannabis products, has literally dramatically improved. So I do believe there's a lot of pets out there that are taking CBD that are not getting great success. And that can come from several reasons. There's a lot of products out there that are not good quality. And even if people happen to fortunately find a quality product, a lot of times they don't know how to dose it appropriately for its best success. People like Robin, who do individualized consults, are finding or are recommending products based specifically on the needs of that individual, the pet or the person. So she or somebody similar to her would help you find a product that is very tailored to what the needs of your pet are, and then expertly guide you through dosing of how to use it for its best success. So that's just one option right there. That's huge. And then we can talk about other herbal things as well, and even essential oils. And as you mentioned, flower essences. We carry a line of products in my practice that are made locally here, but they're available nationally. She's got a great website as well called Blackwing Farms. And that is Meg Harrison, who is the herbalist who founded that company, and her products are fantastic. So I would highly recommend for you to check her out, Blackwing Farms. She blends 3 different modalities in her formulas. And so she actually blends flower essences, essential oils, and homeopathy. And so this is such a unique format, because usually you're choosing one or the other, and they all have their strengths. But her products, in my experience thus far, happen to work better than most anything I've seen out there that is, an environmental or spray or topical kind of approach for calming and for behavioral modification. So she has tremendous variability in her formulas, things from, brave and confidence, new beginnings, calm, drama, trauma, all kinds of different options. So I would encourage you to look at that. And then there's, other Western herbal things that are based with like valerian root and chamomile and passion flower and things like that. So there's a few, companies that make some really nice calming herbal options that are specifically made for pets, that may come in a liquid format or a powdered format. And if you want brands, maybe I can have Amanda list some, on the site afterwards so that you can get some specifics, and maybe we'll list some of these other websites so you can have some actual practical resources you can turn to.
Yeah. Those are great suggestions always. And I too love Blackwing Farms, as you know. And just a quick story, yesterday we were washing all the dogs that come boarding here at our house, get a wash before they go home. And now we got an outdoor, like this bathtub. We finally ordered our own dog bathtub designated just for the pup.
Yay!
So yeah, it's very exciting. These are the joys of this household.
Right.
So we're out with our little Frenchie that's staying here yesterday, and she got super nervous. I don't know if she doesn't get bathed a lot, but like beyond just your average dog nervousness in a bathtub. So I ran in and got my Blackwing Farms, the drama trauma was the one I had, just to kind of calm the whole system. And I am not joking. We sprayed it twice. I know you cover her face. I sprayed it twice, and I saw her like shaking like this, just immediately stop.
Oh,
immediately stop.
So cool. And that is so wonderful. I'm so glad you shared that. I get so many similar responses. And when you get to meet Meg and she gives you, so much of the feedback that she gets, it's tremendous. And I just had a client call us yesterday, and she's like, oh, I have to tell you guys, the drama trauma works so great with my kitties. She had visitors coming over or workers outside in the front that were, making a lot of noise or whatever. And normally, this kitty's very timid and hiding under the furniture, and she sprayed the drama trauma around, and she's like, I couldn't believe my kitty was out and about. It was really tremendous. And she said she hadn't experienced that before in that type of situation. So definitely making a difference. And the other thing I kind of skipped over a little bit is the use of essential oils too by themselves is also a very powerful tool. And I love essential oils. And there's a lot of misinformation out there that essential oils are toxic to cats or bad for, even dogs and animals. And as long as you're using quality oils and you're informing yourself about the oils that are safe to use, which most of them are, but there are a few that you don't want to use around animals. But the vast majority in a quality brand of oil are going to be safe if they're used correctly. And even just diffusing oils into the environment is so good for pets and for us. So I highly recommend. We have diffusers in every room of my practice. I have diffusers in most every room of my home. And that's a powerful tool. And it's not just the aromatherapy, which in and of itself is powerful. We know that when we smell certain aromas, our shoulders drop, and, our mindset becomes a little different, but biochemically, it's actually making a difference in the body too. So that's really important to know. And when you breathe in essential oils, it's actually getting into, the body through, the limbic system and into the lungs and into the rest of the body. When you topically apply, it's going through the skin and getting into the body. And Dr. Melissa Shelton, one of the essential oil experts in the veterinary field, loves diffusion as one of her favorite applications for animals, because the neat thing about that is you diffuse it into the air, they breathe it, but it's also nebulizing and settling onto the skin. So you are getting a double duty: inhalation, entry into the body, and topical at the same time. So that's a pretty neat way. So.
And to add to that, when we talk about the connection between the humans and our animals, the humans are also receiving the benefit of those diffused essential oils, which they may not have that specific skin condition or physical need, but yet when they're aligned to that frequency of healing with that natural element, they are holding that space for their animals. So even helping them more.
So true. So true. And a lot of times the conditions that our pets may have a component in it that comes from the stress or the vibrations that are going on in our home and our environment. And so when we benefit, they ultimately benefit always as well. And it's a wonderful circle where everybody gets to benefit. And same thing with the Blackwing Farms products. I love how on her label, it says emotional nutrition, and she's like for pets and the people who love them too. Because
Meg's slogan is helping the humans one animal at a time. Something like that.
I love it. Yeah. So apropos. Yeah.
Okay, so moving on to another question. We just have, maybe this is actually our last question. Look at the time. It flies when you're having so much fun and learning so much. So this one is from our friend Jenny. She's got this little girl, Stella, who's a little Shih Tzu. So our dog eats small batch sliders. She is almost 5 ounces, and I think 5 pounds is what she meant there. She is almost 2. She has patella, it's that subluxation or whatever it is.
Okay.
I'm not sure of what it's called. What steps should we be aware of to help her?
Okay. So to clarify, she's talking about the knee problem, right?
Yes, the knee problem and what food will help her.
Okay. So again, so this knee problem that you're describing, if it's a luxating patella, which is very common in small breed dogs, and she is, do we say?
She didn't know the name of it, but and she's a Shih Tzu, so she's a small breed.
Okay, yeah. So a lot of small breed dogs will have what, dislocating kneecaps. And the medical term for that is luxating patellas. The patella is the kneecap. And what happens in a lot of small breed dogs is that genetically and even, anatomically, they're prone to this, where the kneecap sits in the patellar tendon, and the patellar tendon connects to both the lower and the upper leg bone, okay, the tibia and the femur, and holds the kneecap in place. And when the tendon is loose or lax, or and the groove in the bone that the patella sits in is a little shallow, then the kneecap pops in and out. Okay, so that's what that syndrome is, just to explain to people. Super common. Oftentimes dogs have very little symptoms of it. Sometimes they can be more symptomatic. And the symptom is typically, and this can be on one back leg or both back legs, okay? And the symptom is, classic symptom is picking up the leg and skipping for a little while, non-weight bearing, legs being held up, and then poof, they put it down and run along like nothing happened. And people are like, okay, how come sometimes they limp and sometimes they don't? And they act like it doesn't bother them. That's because when the patella or the kneecap pops out of place, they lift their leg up and go, okay, this feels weird, don't want to step on it. And then when they extend the leg, the kneecap often pops back in place, and then they tool along like nothing happened. So that's typically the issue. If it's happening all the time, then most veterinarians would be in the agreement that surgery could be a good choice, okay? If lameness is rarely happening, then I definitely would not recommend surgery, okay? There are a lot of food items and other things that we can do to support, the strength of her patellar tendon and ligaments, and just, her joints in general. And one of the big things to be aware of is to keep her at a lean body weight as she ages, okay? Being overweight or obese, for a lot of pets, and obviously people too, is a huge exasperator of joint issues and joint pain and arthritic changes, and as well as a host of other problems in the body. So keeping at a lean body weight is key. That'll be really, really great. And then the diet that you're feeding is awesome. Small batch is a great choice. I would stay in the realm of raw diet, whether or not you want to do some variety between, different brands and different formulas. I'm all for, rotation of variety, but she's on a great choice right now. So what I would say is to add in some really good medicinal foods and or specific supplements for her joints. And these would be things she could be on indefinitely, or at least, often. And as people may have heard me say in the past, bone broth is one of my absolute favorite joint supplements. And I truly would steer people towards spending money on bone broth before I would spend money on a glucosamine chondroitin product, okay? Mm-hmm. Bone broth is going to have that in there and way more. So when the body's getting bone broth, it's going to not only directly help the joints and cushion the joints with more collagen and things like that, hyaluronic acid, all that, but it actually has components in there that are going to strengthen the tendons and the ligaments, which is what your doggy wants, as well as muscle structure and other things too. So bone broth is such a huge plus. And then I would also make sure that you have a high quality omega-3 fish oil, or that you're feeding regular foods that have omega-3 in them. That's another fantastic thing for joint support and anti-inflammatory body-wide. So the combination of bone broth and a quality fish oil or krill oil or, calamari oil, or feeding regular sardines or wild-caught salmon. And that's where some of these the fish diets, maybe from Northwest Naturals and things like that, can actually add that. We have dried anchovies at my practice from Solely Raw that deliver a lot of omega content as a treat, omega-3. So those would be the things that I would focus on. And again, in food therapy, feeding the alien organs, so feeding things with more cartilage in it. So if, a lot of people that feed raw diets literally are feeding chicken feet or, things like that. So when you're feeding bones and things that have tendons and ligaments in them, that's feeding her body to have stronger tendons and ligaments and stronger joints. And the nutritional supplement company that I use a lot of their products for all of my patients and myself and humans that I recommend to, Standard Process makes for humans a supplement called Ligaplex that we use in dogs all the time that literally helps to strengthen ligaments. Okay. And feeding organ meats can do that too. And there's actually organ meat in that product. Similarly, they have a canine specific product called Canine Musculoskeletal Support, which would contain the same nutrients that the Ligaplex would contain and a little more variety. And that is very cost effective for little dogs, but the canine musculoskeletal support can be a little bit pricey for big dogs. So sometimes I just put them on the human Ligaplex, but some great specific supplements out there. But the food items was a great question. So hopefully I covered that well. And lean body weight's always helpful with any joint issue.
Yeah, covered very well, and so interesting to get that reminder yet again. I was thinking, when you're referring to the organs, feeding the organs, that the organ is ailing, but I hadn't thought about it with the physical parts of the rest of the body, like cartilage and
interesting.
Wow, that's great.
Yeah.
Okay, Dr. Kangas, one last question, just because I get this question a lot and it applies to every single one of us that has an animal. So I think it's a great one that Becky wrote in. Thank you, Becky. I've taken my dogs off of heartworm meds. Is there anything natural I should be giving them in place of it?
That's a tough answer. And that would depend. There are natural things that you can do. I am not aware, honestly, of anything that is proven to be really effective specifically for heartworm prevention that's natural. There are specific herbs that you can do for anti-parasite, but heartworm is not an intestinal parasite. So it definitely can, the life cycle is very different. And some of the typical things that might be more anti-parasitic from the herbal realm may not have that effect on heartworm. Okay. So depending on what region of the country you're in, my recommendations may change. Luckily in our area where we are, it's such a low incidence of heartworm that I would feel very comfortable just supporting the body with things to improve the immune system and make the pet less resilient to all kinds of parasites, including, heartworm. However, there are regions in the country that are so endemic for heartworm because the mosquito population is so concentrated